Hello, this is Charles Epstein for the Catalyst Podcast. Today we've got Conlon Public Strategies in the house. I'm speaking with Kevin Conlon, founder and president, and Linda Shapiro, executive vice president, both of Conlon Public Strategies, a strategic advising firm dedicated to advancing the good work of nonprofits and businesses. They join me today from their office in Chicago to discuss the need for agile leadership in today's volatile, rapidly changing landscape. Linda, Kevin, welcome.
Thank you.
Thank you so much. It's nice to be with you.
Same. Thanks so much for taking the time. Kevin, what was the impetus for founding Conlon in 1998? You know, what drove you then? Has it changed since?
Well, for whatever reason, I've always had a great passion for not-for-profit organizations. Even when I wasn't doing this kind of work, I served on many boards and saw them as great change agents and had a background in elected office, having held office for some 15 years. So we started the business thinking that we could be helpful to not-for-profits. And we very consciously...
Excuse me, Kevin, I'm sorry to interrupt. You held elective office?
Yes.
And what office was that?
A local elected office, from township supervisor, committeeman, state central committeeman, and a number of things in the south suburbs of Chicago.
Okay, good. No, it seemed like you glossed over this very important work you did. So wanted to make sure we didn't do that. Again, I'm sorry for interrupting. Again.
Well, I enjoyed that work very much, and it was a great frame of reference. But so what we have done now almost 20 years is work with over 400 different not-for-profit organizations. And what we're trying to do in every case is to get them to the next level. So there's really, we can do whatever they need. So often they'll say we need a strategic plan, we need a stronger board, we need a piece of legislation passed, we're looking for more grants from government or private sector, help us develop a strategy to do that. So in every case, what we're trying to do is build capacity, make the organizations better, stronger, and hopefully get them up to a new level of excellence. And then we hope they call us back 2-3 years later with another challenge and how we can get them to the next iteration of their evolution to even do greater things that make a greater impact.
Yeah, no, thank you. Linda, tell our listeners about your work, the range of companies you work with and support, and of course, your work with Chestnut.
Of course, we work with Chestnut, which is important, especially as it's taken on so many challenges, becoming a community behavioral health center, which is a new model of delivery of care that truly integrates behavioral health and primary care. And we have other organizations that are in that zone as well. Most of our clients are nonprofit health and human service organizations, and those that are for-profit all have social impact missions, but maybe are configured to be a for-profit. I gravitate toward the organizations that are health and human service organizations. I'm trained as a social worker, and I have a huge passion for those organizations. And we also gravitate on occasion toward arts organizations because we see how important they are as community building entities. And I want to say health and human services is very broad. It ranges from child welfare to violence intervention to alternative and charter schools, and helping organizations work in the Chicago public schools and beyond, very often delivering mental health and guidance service, youth guidance services. We work with organizations that help people with mental health conditions, both severe and other, challenges just to well-being. And I would say, most of the organizations, many of our organizations are either concerned with or deliver primary health care and also want to make sure their populations have access to all of the services they need, whether that's substance use treatment or whether it's access to specialty care, diagnostics, or even hospitalization. Almost all our clients serve patients who are low income. Most of them bill Medicaid. Chestnut's a good example.
Right. No, for sure. Do the organizations go beyond serving the region? Are these not like the arts organizations, for instance? Are the
Sure. Yeah, and most of the organizations we're involved in have an eye on strategic growth. How can they partner to do more for more people? So some of the organizations are statewide, some are regional and expanding, especially when they offer something that's it's such a treasure, but hard to access. An example would be mental health or substance use services, or integrated psychiatry and substance use services. And it's sometimes there are pockets of the state or pockets of the greater Chicago area even that don't have those services for people who have basically no purchasing power.
Yeah, I'm
I was
sorry.
going to say, one of the things that brings us the most joy is helping. Often we know of other organizations doing similar or related things, and they just don't know each other in this big community and network. And so often what we do is get groups that are similar doing important things and helping them get to know each other, see how they can complement each other. And after doing this for so many years, I think that's one of the things that we often do the best, is just connecting obvious allies that may not know each other.
I know Chestnut is such a leader in the research space, like Lighthouse Institute. We have another client that we're helping simply to think through her research application strategy in an environment where federal funding for research is changing so rapidly, where the rules are changing. But we're also helping her reach new populations that might benefit from the intervention that she's trying to research, and also to help introduce her to researchers that could serve to fortify her research, maybe serving as a co-PI or a principal investigator, or helping in other ways administer a project that would probably be 5 years in duration and really high impact, helping families who are struggling and helping them reconstitute really strong ways to raise their children.
Yeah, no, excellent. One last question on Chestnut, then I want to ask some more general questions.
Sure.
How did you get started? How did you guys meet? And what's the nature of the work you've done in the years since?
Well, we met them. Ironically, we'd worked with Chestnut some 20 years ago. So we've always been familiar with them and always viewed them as one of the 2 or 3 most significant players in their sector in the state. And so it was nice to get to know them again 6 years ago. And we were brought in more for strategic planning. And we talked a little bit about that, but that was our first project. And now we've helped them in a few other things. For example, they're looking at offices in Chicago for the research center, and we're helping them facilitate zoning and other issues for the Lighthouse Institute. Yeah, and help them on some issues involving federal legislation affecting mainly Medicaid. So we've kind of helped them, and it's just one of these relationships we've enjoyed very much. They're a federally qualified health center, and Linda has worked in that space now for 25 years and really is an expert in the way few people are. That's how Linda and I got to be friends. We represented her when she was at another large federally qualified health center called Access.
So working with Kevin to help strengthen our federally qualified health center back in the day, it was pure gold. I used to say, I just want to talk to Kevin for an hour and something good will come of it. I don't even always have an agenda that includes some of the treasure that's going to come out of the conversation, but when you're in a leadership position, you have a lot of responsibility and accountability. Having somebody to talk to give perspective, to say, why don't you try this? You're on the right, even saying you're on the right track, to validate your frustrations and, be your champion even. It was very, very encouraging. So when I had the opportunity to join Kevin about 6, 7 years ago, it was just so refreshing. And Chestnut was one of the first that we worked on together here I've done a lot of strategic planning. I actually worked for a little strategic planning firm for a while. But we worked so beautifully with Chestnut's leadership team to explore different scenarios, to look at what it's like to be a patient or a client of Chestnut, and look at all the doors that are open to people at Chestnut, and what is the best way for them to organize their structure to make the most effective use of their talent to really be as helpful as they all want to be. They're very mission. They have such a rich mission-centered culture.
I frame this by saying we're going to be talking about the need for agile leadership in today's volatile, rapidly changing landscape. At the organizational level, what are the 2, 3 biggest challenges shared by the organizations you work with? Can you distill it down to 2 or 3?
The not-for-profit space, isn't that uncommon for organizations to be 85–90% dependent on state or federal dollars, or can be city dollars too? So we went through a lot of these challenges with COVID, and now we're going through a lot of changes now where there's always, leaders are kind of always poised for some change, but the change the last couple of months has been so rapid, it's been a little overwhelming and hard to keep up with. We have situations where a grant opportunity would be posted one day, taken down the next, and then brought back 3 days later, and they're doing it again. So it's been tough to navigate. Also, it's been tough for example, the state of Illinois just finishing their budget this past weekend in Springfield. It was very hard for them to calculate what the federal government might do, because that's so much in play and there's so many changes taking place that it made the state's challenge of putting together a budget much harder, not knowing with certainty what the federal government would do to support the work of the state government.
I think this is going to take quite a while to untangle, because even though we might know there are going to be cuts in federal agencies that are so important to our clients, for example, HRSA or SAMHSA, HRSA funding primary care, SAMHSA funding substance use and mental health treatment. We don't know exactly what those cuts will mean in terms of direct funding for the future. We don't know what it means to the state, because some of these funds are passed through to the state, and then they're sometimes enhanced by general revenue funds. And then similarly in Chicago, for example, the city also gets funds that are passed through from sometimes directly from the federal government, sometimes from the state. And so untangling what is going to happen next to the sources of funding that these organizations depend on is, there's no solid ground under people's feet right now for understanding exactly what's coming next.
I do want to talk about the challenges that leadership is facing, but it's almost like the funding challenge is so stiff and persistent. It's almost anything that's secondary is a far second, right? The funding seems to be so, and nothing happens. That's oxygen, that's dial tone. Without that, nothing happens, right? But having said that, I'm sorry?
I love that. It's oxygen and dial tone. Those are good metaphors.
Yeah, and at the same time. I don't know how that works. But in any case, but I do want to ask you about leadership. So what does agile leadership mean? What does it look like in today's environment?
You have to be a leader. It's always hard to lead, And, when things go well, you look like a genius. And then all of a sudden, when things aren't going well and you're losing your funding sources, it's tough because you have to keep morale up. You have to try to make sure that your employees are kept in the loop and understand the precarious position you're in. You have to mobilize and reach out and get supporters to try to help salvage what you have. But I think leadership is more a set of values that is, in many ways, the effectiveness of a message that you're leading your group. The group, we may have to move different turns. We may have to eliminate this program. We may have to modify our plans. We may have to follow the strategic plan to the T, but we're going to carry out our mission through whatever that takes and no matter how many different iterations, but we're going to lead, and I'm going to lead with you and make the same sacrifices that I'm asking for you to make as employees. As a leader, I'm going to try to do the same thing. So I think there's a lot of intangibles involved. But I think that piece of it is really the magic sauce, is the intangibles of really projecting a sense of optimism and going forward. And, really, I'm going to weather this storm. These elections come and go and elected people come and go. But I have a mission. In some cases, some of our clients have been around for over 150 years. And our goal, we want them to be around another, 50 years from now and not let these things deter them from their sense of purpose and mission.
It's easy to make money in a bull market, not so
Absolutely.
easy in a bear market.
It's so important to, reflect on those aspects of leadership that Kevin just mentioned, that the promotion of a culture of commitment to the mission. And, Chestnut's a good example of having a rock solid culture. As Kevin, you've often said, you couldn't build this. This is one of the huge assets. And many, many of our clients have that, which is just refreshing. But the other piece for the CEO and the board is to maintain that optimism that you also mentioned, Kevin. When you have so many questions, staff are asking questions, in some cases the patients are asking questions, and they aren't always answerable. And to have a sense of optimism, to maintain a vision for growth and do enriching community service, deepening community service, while there's so many changes afoot, right. It's a trick, it's a balancing act. Well, but I think that culture and optimism are what I'd say are the two balls that leaders keep in the air.
Right. But optimism to be effective has to be coupled to credibility.
Yeah.
So what does the adaptable leader do to project credibility?
Well, being present, making the rounds. We're using Chestnut as an example, but their CEO frequently visits the different offices, and he is, there's just no substitute for making the rounds, being visible, visiting your different locations, rallying the troops, letting them know that there's a lot of uncertainty in the air, but I'm going to fight to maintain our important work and your important jobs, because without you, we won't be able to carry out our mission. Right. But I think a lot of that is just rallying the troops.
A lot of people talk about accountability and transparency. And I think part of the job is you're clear and you don't make false promises, while at the same time you say, our patients are here today, they're going to be here tomorrow. But we don't know. We may have to shrink some programs. We might have to eliminate or change our focus, because the environment's changed so much, and that projecting the confidence in not just the nimble leadership up top, but of people all the way down to be able to shift and know that there are ways they can continue to build their communities and meet their mission. It might be different, but from a broad view, they're going to keep on.
I think the real important word you mentioned there is accountability. My beloved Knicks lost 6-game Eastern Conference Finals the other day. It was heartbreaking, but it was refreshing to see that some of the guys were holding themselves accountable. So when they say, hey, we're going to come back new and improved next season, the optimism is grounded in something that's believable. Speak about the importance of using board committees and or other non-board advisory groups.
Well, that's something we feel strongly about. So you have board meetings, different committees, whether it's finance and fundraising, all these different key functions. Depending on your size of your board, you have different. So I think it's very important to have regular meetings, to be disciplined, to incorporate those committee reports into the regular board meeting. Most boards meet quarterly, some every other month. The federally qualified health centers typically meet once a month, but that's important. We also have been working with different models that we're proud of, where in some cases you have a small board, maybe 10, 12 people. Other boards, we have clients with up to 50. And if it's a smaller board, there isn't a lot of different voices to really supplement these committees to make these little committee meetings interesting. If it's the same 10 or 12 of you, you can only be on one or two committees. So what we've done is we've started, in some cases, a thing called a leadership circle, where it's like an auxiliary club, if you will, president circle, leadership circle, you can call it whatever. But what we've done is we've changed some of our clients' bylaws so that those people can be in the committee. So let's say, for example, you have somebody who's really skilled in real estate and really is too busy to maybe be a regular board meeting, but is happy to go to any of the committee meetings dealing with real estate. Or someone else is the gifted fundraiser, they'll go to the development committee, but they don't want to be on the board per se. So it allows these folks to really bring their expertise and to, I think, enrich these small committees to make them more vibrant. They're typically non-voting members, but it makes the meetings much more interesting. And then it's also a great pipeline for future board members. So and that's we're very proud that in one case specifically, I think the last 3 board members have come from the leadership circle or leadership council. So that's a way to get new ideas to enrich your level of conversation or make the conversation more interesting by this infusion of other people to make the board a little larger without really making it larger.
What is the role of advocacy in your work with your clients?
Well, advocacy can be a lot of things. And I tell our organizations that we work with, much of advocacy is just being visible. So many of our organizations do really thoughtful newsletters, but it doesn't occur to them to send it to a state rep, state senator, county board member. And if you send 3 or 4 of those a year, all of a sudden the elected officials start to know you and think of you as an expert in your area. So a lot of it is just visibility, making sure that you're inviting them to open houses, doing outreach. And then I think it's important to visit your elected officials. And our clients typically do that in going to Springfield for a day and have an outreach day for this client or that client where they visit all the elected officials that represent that particular client. And we do the same thing in Washington, D.C., where we'll represent maybe there's 4 or 5 different congressional districts in our organization, and we'll visit all 4 or 5 of those members. So I think it's many things, but I think advocacy starts with being visible and being consistent and constantly looking for opportunities to connect with your elected officials and going to them not when you're in a crisis, but having a relationship with them. When good things happen, to let them know, hey, we just got this grant, we just opened up this new office, can you come to the open house? So it's a very reciprocal relationship. And I think if you do that, when you get in tough predicaments, the elected officials instinctively know you and want to help you. And it's just not a one-way street of what can you do for me?
Yeah, is the advocacy work you do, is that an increasing portion of the work you do these days, or is it fairly consistent year to year?
It depends on how you define advocacy. Kevin will register as a lobbyist for clients where that's what's being asked. But we also encourage our clients to think about profile raising, to make sure they have a clarion voice for the role that they play and the good work they're doing. And there are times where we'll encourage them to write a letter to an editor or have an op-ed that they pen, or we can even help them outline it, or think about what they want to say to make sure that their voice is heard and known. So, and sometimes advocacy is simply showing up in the community when we know about community contributions, community coalitions where we know our client can make a contribution. We can, make those introductions and make sure that they're there, and that they actually plan to allocate the resources to this work, because it's not directly client facing or patient facing. And sometimes that it doesn't seem as apparent to organizations that this should be a staffed and resourced part of the organization. It's part of the living, breathing engine of the organization.
One of the
important.
One of the important things too with advocacy is to identify champions that really care about your issue. And I think, fortunately, because of the work we do with so many social service providers doing important work, they instinctively want to be champions. So our job is to educate them, make them conversant on the issues that our clients are doing, so they emerge as thought leaders in their legislative circles. And that's really the ideal thing. How do you build champions? And then we want our leaders, our executive directors, CEO, presidents, to be positioned as thought leaders. So when the issue comes up, well, how is Medicaid cuts going to affect Illinois? We want them to instinctively call the CEO of Chestnut or the CEO of some of our other clients and say, come testify. We need to know how this is going to affect people in your area.
Yeah, we talk at the outset about changing times. We had somebody on recently who characterized these times as chaotic times. They didn't think uncertain times was strong enough. So navigating through all this on an organizational level, at a leadership level, it's easy to say that these challenges are unprecedented, but to what extent are they? And to what extent are you dealing with things you've never dealt with before?
I think it's what's most unprecedented is this very large wholesale reduction in federal funds directed at the kind of work our clients do. And the lack of clarity. Is this a reorganization, or is this a wholesale cease forever supporting this kind of work? And we just don't know. And so it's very hard to have a strategic North Star when you don't know what support's out there. And I know some of our organizations say, okay, we have to look at other sources of support, but almost every expert is clear that the amount of money that the federal government has put into health and human services historically, as well as other sectors, higher ed, et cetera, it can't really be replaced by philanthropy. We're just talking about a whole different magnitude of financial support. So this puts every leader in what I would say an unprecedented state of, and I think chaos is a good word, of not really being able to anticipate what's happening and translate what's happening to what their strategy is going to be. They can do it in broad brushes, and that's what we talked about before. They can't make false promises, right? But they can reflect on the strength of what they are doing today and the strength of their culture and commitment and mission.
It's interesting, as we're talking, I'm thinking how your organization aligns with Chestnut. You talk about agility on many of the conversations I have in this podcast with Chestnut's and Lighthouse's research scientists, implementation scientists. The through line often is the creativity that it takes to get these programs funded, the creativity it takes to lower access to services. So I can see how you two organizations, talk about culturally are very simpatico. Any final thoughts?
Well, I was thinking of an example recently. Maybe you want to explain the one that Krista mentioned about growing, but growing differently. is I think
Yeah.
a really good example.
Yeah, we worked with one client who we helped her define her strategic plan. She's a relatively new CEO. And by the way, we work with a lot with new CEOs to really support them, and support the board and board chairs to make sure that that things are going smoothly. We support them to define clearly in their first 100 days what they've seen, where they're headed, in line with the history of the organization. This one CEO had been there about around 4 or 5 years, had a sense of strategic direction, and then a really refined strategic plan that caused for growth to serve more people in more jurisdictions. With the change in funding, she's been able to swap out her growth agenda to, instead of growing to provide more direct service, she's looking at being a technical assistance resource to some of the smaller organizations on the ground that don't have the capacity for all the back office functions, or even to evaluate and talk about their impact, but yet are very, very important in the day-to-day work that they do. So her growth is really now in the area of being a technical assistance advisor, and not in the area of providing direct service. But yet she is quite in line with her mission. Her technical assistance role, at least for the year or two ahead, is funded. It's a pipeline that had been out there for a while. So that's something she can speak with certainty about to her team. And it is a different definition of strategic growth. She's been very nimble to put in place.
Excellent. In case, guys, I really do appreciate you taking this time. It's a great conversation, and you guys are doing amazing work. So thank you.
Well, it's
Thank
our
you.
pleasure. Thanks for having
Thanks
us.
for asking us. Yeah.
Today, I spoke with Kevin Conlon, founder and president of Conlon Public Strategies, and Linda Shapiro, executive vice president, also of Conlon Public Strategies, a strategic advising firm dedicated to advancing the good work of nonprofits and businesses. They joined me today from their office in Chicago. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.